Now with two experts, Dr. Sanjay Jain, board certified physician, author of the book Optimal Living 360, Smart Decision Making for a Balanced Life. He'll be Skyping in. We're also pleased to be joined here at our anchor desk by Nick Tate, our Newsmax deputy health editor. Gents, we thank you both. Nick, let's start with you. We go through security screening at the airports. What is Ebola screening going to entail?
Two things are going to happen. The passengers incoming from West Africa will be asked questions about where they've been, who they've had contact with, and whether they believe they've been exposed to Ebola. There will also be spot checks with these handheld temperature gauges that will determine whether or not they have a fever. The problem is they are certainly a step forward, and the implementation of these 5 airports is going to raise the level of security. But if we look at what happened with Thomas Eric Duncan, who came in, the first patient to die, he would not have been caught by these screening procedures because by all accounts he did not tell the truth about where he had been, and he was not at that time having a fever. So my question is, will they actually be effective?
And the other question has to be exactly who is going to be performing these screenings?
That's right. It appears that it is going to be customs folks to some degree, but there may be extra specialists that are on hand. We're just not sure about the nuts and bolts. We'll learn on Saturday at JFK where the first airport rolls them out.
Dr. Jain, let me talk to you about this. Do you believe that these are the correct first steps that should be taken?
Well, it's not a bad first step, but the problem is that, if you're really sick and if you really want to get through the system, you can break the system. You take a few Tylenols and actually you can lower your fever. If you're a little bit febrile, you can walk through and not have a fever or not have a detectable fever through these preliminary scans in the airport. So there's ways to get around it. So my concern is this foolproof? Absolutely not. And you're asking non-medical people to all of a sudden become doctors, to evaluate people. So there is some concern. It's a great first step, but there's still a long way to go.
It's a great first step. Just forgive me, my impression is it's a late first step. And now that we're hearing Dr. Frieden say, well, we'll put this in effect over the weekend and then we'll sequence in other airports. Why on earth this rollout that takes a period of days? Is that smart, Doctor?
Well, this is something that should have been, I agree, it should have been done long before, and it is a little bit too late. Once we had to have a shock to our system after this gentleman from Dallas got diagnosed. So now that we had a shock to our system, we're finally figuring out it's finally on our soil. We got to do something about it. But I agree, this is a little bit something we should have done a lot earlier.
And there's another thing going on. New York's LaGuardia Airport, situation with the cabin cleaners. They walked off the job. They're concerned about unsafe working conditions. Now the cabin cleaners at LaGuardia, is that going to happen at all the other airports? Nick, what's your take on that?
Well, the likelihood is that folks are going to be asking for things like hazard pay and saying, my job is not worth my life. So the likelihood is that there may be others who will step back. We've also heard from hospital workers in Spain where the first case diagnosed there has taken place, and hospital workers are walking off the job and saying, you know what, we're not in for this. We're not prepared for this. Nurses in the U.S. have said in new polls as many as 60% don't believe they're prepared to handle this, so it's a legitimate concern.
Doctor, let me go back to you on in the case of the cabin cleaners at LaGuardia now on strike. They're obviously not medical professionals. Can you fault their instincts going, oh, wow, I don't want to mess with this?
The likelihood of them being infected is very low, but I understand their concerns. They have people that they don't know who's going through the airports, the system, the airplanes, and so they're obviously concerned. So from that perspective, psychological, I can understand that. But from a reality perspective, the chances of them acquiring Ebola is very low.
About a minute remains in this part of our discussion. Let me turn again to Nick Tate. Nick, we heard the president say that he was going to have other nations join with us to act internationally. Any progress on that front?
Sadly, not really much to report there, but one of the things that I think is key here is, as we've seen with the delays in the implementation of this particular plan, why are we delaying putting in tougher travel restrictions to and from West Africa and the U.S.? It seems to me that one thing we could do is if we put those kinds of restrictions in place, other nations might follow suit. If we don't, they may not follow suit. It seems to me the best way to isolate and contain this virus is to keep more people from leaving the country and bringing it elsewhere.
Well, there is so much to this topic. Gents, I'm going to ask you to come back and join us next hour to continue this conversation. Dr. Sanjay Jain Skyping in, Nick Tate here with us at the anchor desk. We'll get back to Ebola in the second hour, and there's more to come.